Genital warts are a common sexually transmitted infection (STI) caused by certain strains of the human papillomavirus HPV. They appear as small growths or bumps on the genital and anal areas and can vary in size and appearance. While they are usually painless, they can cause discomfort, itching, and emotional distress. Causes: genital warts are caused by HPV, particularly by low-risk strains like HPV-6 and HPV-11, which do not usually lead to cancer. HPV is spread through skin-to-skin contact. Sexual contact with an infected person, including vaginal, anal, or oral sex, is the most common way HPV spreads. Transmission even without visible warts. You can contract HPV even if the infected person doesn't have visible warts. The virus can still be present on the skin. Mother to child. The pregnant woman with genital warts can pass the virus to her baby during childbirth, though this is rare. Symptoms: genital warts may appear weeks or months after exposure to HPV. They can vary in size, shape, and location. Appearance: small, flesh-colored, gray, or pink bumps. They may be flat, raised, or cauliflower-like in appearance. Warts can be small and difficult to see, especially in women inside the vagina or on the cervix. Locations: in women, around the vulva, inside the vagina, on the cervix, or around the anus. In men, on the penis, scrotum, groin, or around the anus. In both sexes, genital warts can also appear in the mouth or throat after oral sex with an infected person. Other symptoms: genital warts themselves are usually painless but can cause itching, bleeding, or discomfort, especially during sexual activity or if irritated by clothing. Diagnosis is typically made through physical examination. Healthcare provider will examine the genital area to identify visible warts. Colposcopy for women. A magnifying device may be used to examine the cervix for warts or abnormal cells if HPV is suspected. Biopsy. In rare cases, a small sample of the wart may be taken and examined to confirm the diagnosis. HPV testing. Women may also undergo HPV testing during a pap smear to check for the presence of high-risk HPV strains that can lead to cervical cancer. Treatment: there is no cure for the underlying HPV infection, but genital warts can be treated or removed. Treatments focus on relieving symptoms and removing visible warts. However, warts can return, as the virus remains in the body. Topical treatments: Podophylax Condylox, a topical cream applied by the patient to destroy wart tissue. Imiquimod Ultra, Cyclara, a cream that stimulates the immune system to fight off the warts. Sinocatechins for Genital ointment derived from green tea extract, used to treat external warts. Procedures to remove warts: cryotherapy, freezing off the warts with liquid nitrogen. Electrocautery, burning off the warts with an electrical current. Laser treatment, using laser energy to destroy warts. Surgical removal, cutting off warts in more severe or persistent cases. Complications: while genital warts themselves are not dangerous, they can lead to complications, such as recurrence. Even after treatment, warts can return, as HPV can remain dormant in the skin. Emotional impact. Many people feel embarrassment, anxiety, or depression due to the stigma associated with genital warts. Risk of other HPV-related cancers. While genital warts are caused by low-risk HPV strains, infection with other high-risk HPV strains can lead to cancers such as cervical cancer in women, as well as penile, anal, or throat cancers in both men and women. Prevention: the most effective ways to prevent genital warts and HPV infection include HPV vaccination. The HPV vaccine Gardasil 9 protects against both low-risk strains which cause warts and high-risk strains which can cause cancer. It is most effective when given before sexual activity begins and is recommended for both boys and girls, typically starting at age 11 or 12. Condom use. Using condoms during sex can reduce the risk of HPV transmission, though they do not provide complete protection as HPV can affect areas not covered by a condom. Regular health checkups. Women should have regular pap smears and HPV tests to detect any early signs of abnormal cervical cells or cancer. Limiting sexual partners. Reducing the number of sexual partners can lower the risk of contracting HPV. Conclusion: genital warts are a common symptom of HPV infection and can cause physical and emotional distress. While they can be treated, the underlying virus often remains in the body, leading to potential recurrences. Preventive measures like the HPV vaccine and practicing safe sex are key to reducing the risk of infection. If you notice any unusual growths or symptoms in the genital area, it is important to seek medical advice for diagnosis and management.